My name is Dr. Michael Osu. I'm a lecturer at KNUST in the Department of Medical Diagnostics and also the head of the Genomic and Infectious Disease Lab at KNUST. For this week, we started training laboratory scientists and professionals across various fields, some from the Ghana Health Service, some from the veterinary laboratories, some from CSIR, others from the animal space as well. Our focus is to help them to understand how to use rapid diagnostic kits, particularly for pneumococcal testing. But on top of that, we also want to train them in how best to handle clinical samples and then use molecular-based methods, both conventional PCRs and qPCR, to identify these targets. And we feel this is important because as part of the priority pathogens in Ghana, pneumococcal pathogens are part of it. We always experience outbreaks in loading belts. And we feel that it's good that we are able to build capacity of laboratory scientists in how to use rapid kits to detect this, but to prepare them to use molecular approaches also in the future because of emerging strains of some of the diseases. So we think this training is very helpful and will put our lab teams in a very good perspective to prepare to handle outbreaks that will come, but also other emerging pandemics that may arise in the near future. This training has been made possible through collaboration with JHPIEGO, an NGO that supports capacity building, and also the Ghana Health Service, who have given us opportunity to collaborate with them in this training program. Again, the Center for Health System Strengthening has also been very supportive, and KNUST also has been the host for getting this training program done.
Hi everyone, my name is Nkrumah from the Greater Accra region. I work with CSIR Water Research Institute.
My name is Patience Nalatika Adams from Noguchi Memorial Institute for Medical Research.
Hello, my name is Nathan Fujoe, and I'm from the Western North region. I'm with the Inchi Government Hospital.
I'm Perpetually Ofori from the Upper East region. I'm currently with the Paga District Hospital and the Paga Port of Entry Laboratory.
My name is Nana Asamu from the Greater Accra region. I'm at the Biomedical and Public Health Research Unit of CSIR.
My name is Edmond Kwame from CfHSS Municipal Hospital in the Western North.
My name is Emmanuel Edwine, laboratory scientist at the Whole Municipal Hospital.
My name is Frederick Obey Amwa, a microbiologist at the Secondary Public Health Reference.
My name is Thelma Tete. I'm from the Greater Accra region and from the Ghana Infectious Disease Center.
My name is Dr. Wisdom Salasi Mensah from Wasako Government Hospital, Western region.
I love how intensive the training has been, meeting and networking with various professionals from different regions across our nation. And we were taken through pre-analytical errors, we were taken through quality assurance, we're also taken through advanced molecular diagnostics. But in the midst of all these, what stood out for me was how we were allowed to deal with real life problems, how we diversified in understanding the question, how we solved it, and even presenting it to our senior professionals in the field, how they even helped us to understand it better. And for me, it has empowered me, even as a molecular scientist, going back to train my colleagues to do things in a better way. In the lab setting, sometimes we overlook some of the best practices, but now I'm going to train my colleagues and some of the trainees to work in a better way to achieve the best results from molecular diagnostics.
This training has been very vital to my professional development. We live in an era where there is a lot of outbreaks and unprepared responses towards infectious diseases. But with this training, we are now well equipped and we have got a lot of confidence to face these diseases head on whenever they arrive in our private facilities.
One thing that stood out the most for me was the scenario-based activity where we were grouped and then we were given the problem of the day. We had to rack our brains, brainstorm to get answers to these tough questions. Yes, but I guess I learned from most of my team members because they had mind-blowing answers. So from where I'm coming from, you already do the molecular works, right? But this training has really helped me gain deeper understandings to the principles behind all the molecular works that we do in the lab. Marburg virus disease came in 2022. We're able to kill it. Right now, I can say with my full chest that when the Ebola comes or the hantavirus, we are going to kill it.
So in my years of working, I've been to various workshops. But then what makes this one unique is the fact that emphasis was placed on the practical aspects of whatever we're here to learn. Of course, we talked about the RDT test kits, we learned the principles, and also we had the opportunity of seeing how we could use it and the things that could inhibit our work in using these RDTs. And then from where I'm coming from in the north, it's very common to have meningitis outbreaks. And so this is very timely in how we are going to be able to roll out these RDT test kits. And also we are on the border, and so our experience with the DNA extraction and then the PCR gives us the skills that we need. And in the event that any donor should give us these machines that we could use, it puts us in a strategic place to be able to identify any outbreaks that may originate from the border where I'm coming from.
It's really been a good experience, especially in the field of molecular medicine, where we were taken through a lot of techniques, which when we actually sat, back in our various places, we thought or saw it as a big deal. But then our facilitators, through their enviable wisdom and knowledge, really simplified everything for us. We've had hands-on practicals on some of the DNA procedures. And then it's really been nice having been part of this program. I believe this entire exercise is going to have a very great impact on Ghana Health Service, individuals, especially lab scientists, in preparing us for any eventualities or outbreaks that may happen. And then as well, we also hope that when we go back, we'll really teach our subordinates and colleagues and other people in the field so that we will all be on the same page so that we can arrest any possible outbreaks that may emerge in the country.
Here I have learned on RDT, DNA extraction, PCR, and then quality management. Based on my experience here, I've been able to have hands-on experience with the practical session where we've extracted DNA, we've done master mix and then PCR, and we've also worked on RDT and how we are going to apply it into our various lives, and also how to teach my colleagues when I go back on that, so that in case there's an outbreak, we'll be able to do our best to help fight for Ghana.
This training has equipped me with new knowledge on how to molecularly diagnose meningitis, and it has equipped me with new knowledge that I'll be able to share with my colleagues back at the facility.
So this is not my first workshop. I've attended quite a number of workshops. What makes this particular workshop different is the fact that you have an early morning section where you talk about the theories, and then on that same day you move to the lab to do the practical. So if you are not clear with the theory, you have the practical to support whatever you've been looking at. We've been here, this is our third day. We've looked at our DTs. On that very same day, we came to the lab to do our DTs. And yesterday we were here, today we are here on the molecular testing. We've been doing nucleic acid extractions, and today we are here for amplification and electrophoresis. So irrespective of the level of your facility, you have something to take on from here. And one interesting aspect of this workshop is it encompasses quality assurance. So those that are new to quality management system, they get to meet it for the first time. And those that are already in the practice too, this serves as a refresher training for them. I'm the quality manager for my facility. This has been very helpful for me. Aside learning the technical aspects, I've built on my quality management skills. And from here, I'm going back to implement more than I used to do.
The workshop has helped me connect the fundamental theory of DNA replication to the realities in the lab. During the lab session, I gained hands-on experience in DNA extraction, polymerase chain reaction, and gel electrophoresis. And I look forward to bringing the new skills that I've learned to support the research we do in my lab.
In my line of work, speed and accuracy in diagnosis help in patient recovery, and during this training, it has impacted me with knowledge in molecular diagnostic and rapid detection for pneumococcal diseases.
I want to thank God.
I'd like to thank the JHPIEGO, Ghana Health Service,
and KNUST.
Our facilitators as well, they've been very helpful to us.
I want to say a big thank you for this opportunity.
We appreciate your funds and your commitment.
And I would love to come for any of such trainings again.
Kindly make this flow more so you can have this at least twice or more in a year.
God bless you.
Thank you.
Thank you.
Onyame nhyira mo bebree. Yɛwɔ adwo ne babaa o.